And this meeting is the Board of Health meeting of March 16th. And we have a quorum. There's 4 of us here. Can we approve the minutes of March 2nd?
Yes.
Anybody have any problem with them? Okay, hearing no objection, I'm gonna accept them. So 56 Wendell Road, did I tell you that after our meeting last time, I signaled Kathy Steve and got a phone call at home from Greg that very evening. And he said he didn't get my messages. I'm not sure why that would be, but he said he didn't. So he is asking for an extension of the condemnation. The condemnation required that the house be demolished by March 23rd of this year, which obviously is not going to happen. He's not doing nothing. That's the crucial thing. He has had it tested for hazardous materials, and he got a verbal assurance that there is no there are no hazardous materials, but when we spoke, he still hadn't received the written report. Right now it's about, and he has a contractor to do this, he has an estimate for doing it, but his insurance doesn't want to pay the whole thing. They're wanting to pay about half of it. And so he is with a lawyer dealing with the insurance and trying to get them to pay the full demolition cost, as well as other costs that he has incurred, like rent, for the apartment that he's living in and so on. So he has asked us to extend the condemnation deadline for 3 months. I told Charlie this, and Charlie said that there's no provision in the condemnation order for extensions, but what we could do is simply decide not to take any action for 3 months. So I propose that is what we do, that we vote that while the condemnation order is set to expire on March 23rd, that we put off any action on it until say June 30th, or until the house is actually demolished, whichever comes first.
Kat, it's Noreen. I'm wondering if there's a middle ground kind of approach, and I'm wondering if we could. I'm okay with not taking any action other than I might like to have Greg report to us on a monthly basis between now and then.
Okay.
The progress he's made.
That seems reasonable to me.
And if
yes.
I may, I have a concern, I guess, about, and maybe it's not warranted, but concern about what sorts of liability positions we might be putting ourselves into by just not taking any action. Like, if something were to happen where someone got hurt, or there was some other unwanted repercussion of the house still being standing for the next 3 months beyond the deadline, and something happens and it's found out that the deadline had passed and the Board of Health did nothing about it, could we be in a liable position around, like a lawsuit or something?
Well, that's a good question. We are covered for that kind of thing as town volunteers.
Mm-hmm.
It seems unlikely that would result in a lawsuit against us, especially since Greg is apparently keeping the place pretty secure. But if that's a concern of yours, what would you suggest as an alternative?
I don't know. I don't have suggestion, and I honestly think my concern is probably, it's a long shot that anything would come up, but I guess the nature of these types of situations is that they're not always predictable. Anyway, is this a situation we might want to run by town council?
I'm not sure.
No.
I'm not sure. I'm trying to think of some way that we can kind of thread through this.
Does Charlie
Go ahead.
Kinnicky have experience in other, like when he makes this suggestion to just not take any action for an extended 3 months? Has he done that before?
I don't know. I would assume that he probably has. Would you be more comfortable if we did it month by month?
Meaning a report monthly from the owner.
And yeah, and then we would again, basically what we would be doing tonight is deciding to not move against him in some way for his anticipated failure to have the house demolished by the deadline.
Right.
And so if we said that we would extend clemency here and give him another month, at the end of which he should report to us, would that feel better to you?
Yeah, I guess so. And so that if there were to have been some event where someone was harmed, then I mean, God forbid, but at least we could show that we were acting on it on some sort of a regular basis. We weren't just sitting on it. Do you know what I mean?
Yeah, I do. And it seems like maybe what the outcome tonight could be is that we could, how can I put this? Well, we would have to wait until the 23rd because, I mean, who knows, the house could fall down by itself between now and the 23rd. But after the 23rd, well, that's one thing. The deadline's not up yet. And our next meeting after the deadline is up is the first meeting in April. So we might be smart to just put that off until the first meeting in April. And then we can say, okay, you're in violation of your condemnation order. And we're giving you an extra 30 days. Right, at the end of which we expect a full report, or ideally your house to be knocked down. Right, and then after those 30 days, we could renew that if necessary. Does that seem better to you?
I feel better with that. Yeah.
Okay.
Do we need to specify at all what we mean by a full report? For example, you're saying he has an attorney who's interfacing with the insurance agency. Do we need any actual evidence of that? I mean, I'd like to see some evidence of that.
Okay, that seems good. Hang on a second and let me make a few notes here. So we wait until the first April meeting. We find him in violation of the condemnation order. We grant him 30 days reprieve, subject to the receipt of a full report of the current status of the demolition, and including correspondence with the lawyer and or the insurer.
Insurance.
Yeah.
And I think I would just add to that a written report, because we haven't heard from him in the past.
Well, yeah, I didn't, he actually did send me something by email. Let me find it and I'll read it to you.
And by written, I mean, an email would be sufficient, but something in writing to the board that just gives us an update.
Right. Okay, here's the update that we got from him on March 9th. We have been waiting for several things to fall into place since August. We have been struggling to get a written notice from National Grid for confirmation of electrical disconnect. We have had the hazard, asbestos and lead tests done, but so far have not received the written report which the demolition company needs. We have a company that is ready to complete the tear down of our house. Gary Gray is the manager and has provided a quote for the demolition. We are waiting for Amico and the demolition company to resolve the differences in demolition costs. I spoke to our attorney last week to wrangle these details as it has been an arduous task.
Mm-hmm.
And then he asks for an extension to the order, and that's it.
Mm-hmm.
So that's the written report that we have so far received. Do you want me to send this to you? Would you guys want it? I should have, but I didn't think of it. So I'll forward it to you. You can have it if you want.
Yeah, then that way Wim at least has it as well.
Right. And okay. Okay. Are we satisfied with the course of events that we've just outlined? Is there more that you think we should do?
Yes, hearing what you just read and based on what you just typed out as our response, I think that is good.
Everybody good with that, Arlene?
I am. Yes, I am. Thanks.
Yes,
Marion?
yes.
Okay, all right. Great, thank you. This has really been a saga, huh? Yeah.
Yeah.
Okay, we've got 3 disposal works construction permits.
Catherine, just real quickly, Mary Ann has joined us. And
oh, okay.
Oh,
Let's talk to Mary Ann then.
Yep.
Hi,
Hi, Mary Ann.
Hi, Marianne.
I'm
Mary.
in the Board of Health room at Town Hall.
We can
Oh,
tell.
Yeah.
So,
Oh, our filing
forgotten.
cabinets.
yes, yeah.
I haven't forgotten what it looks
Yes.
like.
Now
Oh.
look, there's the chalkboard. you
Oh,
know.
gee.
Oh,
Yeah,
wow.
yes. Yeah, there's, the stuff on that side of the room. So nice. Yeah. So
If you're in there, I'll
didn't
buy
think-
your.
I am. I didn't think I came over to talk to Becky and then she was in a Zoom meeting that I wanted to pop on. So I popped onto that one and then I said, well, I'll just stay and pop on this one here too. So, so here I
There
am.
you go.
And I think
if-
the building is empty. So
Oh, yeah, I was just gonna say, if you're all alone in there, you can take that off.
yes. Yeah, now I am. Now I think it is. Yes.
So what's on your mind?
So I came to talk about the composting toilet, which is disgusting, and was disgusting. It's just time to have a talk about this composting toilet. So the composting toilet has never been awesome, it smells, it has fruit flies. These are under, pre-pandemic conditions. Sometimes people who are not well have needed to use it. And you can just imagine people not well using a bathroom. Sometimes people have, I have found human waste in other places in that bathroom other than in the compost toilet. So, and then early on, there was concern about COVID. Well, first in urine and then in fecal matter. And in a regular bathroom with a flush toilet, you can flush away all of the human waste. And this composting toilet, because of the design, the human waste really stays right there in the room. And And then somebody, a human being, has to empty the composting toilet by hand at a point in time. And what I was explaining to the library trustees last night is it's not like it's down on the ground and it falls into a bucket and you can have a bag in the bucket and you can just lift the bag out of the bucket. It's not even, which even that sounds pretty gross. It's actually it's about chest level for me as a person who has emptied the composting toilet. And so it's hard to do, and compost falls all over the place. So the trustees have closed the composting toilet, and just feeling like it's a failed experiment, and that there needs to be a different solution. And we're in a period of transition. And I do have a really good idea of a permanent solution, because that building will have a life for, beyond the library being there. And we don't know yet if the library is gonna, be there for 2 more years or 10 more years. But in the meantime, we wanted to see what you thought of the composting toilet and if you agreed that it was disgusting and reasonable to close it. Really, that's all that I came here for.
Well, Marianne, let me ask you this. How did you come to have this composting toilet? Did the Board of Health order you to put in some kind of a toilet, or did you? Okay, so it's yours. It's not under our orders. We permitted it, but we didn't require it. So I think from our point of view, you can do whatever the hell you want. You can close it or not. It would be right. I mean, it's really nothing to do with us. We don't require you to have a bathroom there.
Okay.
All right. So what's your great idea?
Okay, so my great idea is, so the Hitchcock Center also has composting toilets, but it's a completely different thing where it does use some water. So like our toilets, there's no cleaning mechanism. And it's a building without water, and you're not supposed to put any chemicals into the compost, because then you can't dispose of the compost the way you're supposed to dispose of it. So at the Hitchcock Center, they have composting toilets that use a very small amount of water and a foam soap that is designed to use. So there is a flushing mechanism, but it's mostly this foam. And then it does go into a sort of septic-y kind of system. I need to do a lot more research, but those feel promising to me. We'd have to have water in the building, and then there could be a tight tank like they have at the lake, so that we don't have to have a whole leach field. And so those Hitchcock Center toilets, it takes 135 flushes to equal 1 flush of a regular toilet. So it would take a long time, so I don't know how often people at the lake get those tight tanks pumped, but this library toilet wouldn't be used, and there wouldn't be a shower or a washer dryer or a kitchen sink or, that other kind of water waste. And the other thing that I learned in all of this research is that there are federal laws about bathrooms. So there's not an ADA requirement that there's a bathroom for the public. That I learned that today. I was surprised by that, but there is an ADA requirement, not an ADA, an OSHA requirement, that there's a bathroom for staff, and that bathroom have running water for hand washing.
Yes.
So I didn't know about that. We don't have any staff that's going to make a case out of that right now. But these are things that we just have to sort of be thinking about and planning about.
So what are you thinking about as a water source? Or are you thinking of tapping into another well up there, or drilling, or what?
So I guess I've just started thinking about this, because I've been busy thinking about other things. And really, and I kind of thought it was okay to just say that the composting toilet was closed, but we've had a couple of townspeople, just to be very, a number of people have asked, and I just answer, my first simple answer is it can't be sanitized. And we had all of those sanitation requirements, in the beginning of COVID. And I actually think we're still supposed to be sanitizing things, maybe not quite as much as in the beginning, but we're like, they haven't said stop sanitizing things. And so most people, when I've said it can't be sanitized, they're like, oh yeah, they remember. And then they,
Yeah.
but we've had
Well,
a
it's a good line in any case. I would keep using it
Yes.
if I were you.
Yes, I will. It's true. But we've had a couple of people be, just sort of not
Inconvenienced.
accept it. Yeah, they just don't accept that. And
Well, yeah,
and-
well, and especially since town hall was closed, that was really inconvenient.
right,
But now it's
Right.
open, so
right.
they could
It's
go
open.
across the street.
Yes, they can. They can go across the street. The building was there without a toilet at all for 110 years or something like that.
Right.
So, and the staff doesn't mind coming across the street to town hall.
Mhm.
We're considering getting a porta potty for outside, as a temporary solution for the public. But now that I know it's not an ADA requirement, I just learned that today, that it's not an ADA requirement. I'm just going to sort of sit with that for a day. And I still think it would probably be a nice thing to do to have a porta potty outside, while we are coming up with a solution.
Mhm.
It is about $400 a month. Yeah, did your jaw just drop when I said $400 a month, Garrett? So okay. Okay.
I suppose I could come up with a colorful comment
Okay.
about that.
But it's, when you compare, so what would that be? $4,000, $5,000 for a year. When you compare that to a $6.5 million budget, it's not, it's not nothing, but it's not,
It's not a
It's-
huge big deal.
it's not a huge big deal. I mean, I'm going to have to ask, I'm going to go to the finance committee and ask them to fund it somehow, because the library doesn't have that. So anyway, so that's where we are. Okay. So I kind of like that, that you don't have any jurisdiction, over it. I mean, I don't, it's fine that you don't have any jurisdiction, and it doesn't seem like any of you are saying the composting toilet is not disgusting and we should keep using it.
We'll take your word for that, Mary Ann.
Really, we're
All
not
right.
going to come do an inspection. And I think that you have gone above and beyond a library director's usual role when you've gone so far as to empty it yourself. My God.
Yes.
Yeah.
I don't know if that's above and beyond or sort of deep down below, but either way, you shouldn't have to be doing that.
Right.
Right.
Exactly.
Right. Well, here in the town of Shutesbury, many of us take on roles that wouldn't be considered professional services.
Sure.
Oh, for sure.
For
sure.
And mostly we do it happily. And I'm done being happy about the composting toilet.
Yeah.
So, yeah, okay.
Fair enough.
Yes, okay,
Right.
yes,
Right.
yes, okay.
Right.
So-
So it might be, I mean, just have this in your pocket of ideas here. It might be more cost effective even just to put in an ordinary tight tank with a flush toilet. If you're bringing in water,
Right.
those tanks are 2,500 to 3,000 gallons. And if you
Okay.
have a low flush toilet, that's a lot of flushes.
Right.
And
Right.
and a composting toilet, it in itself is very expensive all by itself. So
Right.
it might be,
Right.
it might not be cost effective to use that if you're going to have to have water too.
Right, right. So we're gonna have to do some research, and that is, you know, so that's good to know. You know, how big a tight tank is, and we're gonna have to, you know, an engineer is gonna have to design the tight tank and bringing the water in. So the church has a well, but doesn't that well belong to the town? Does, and can you, can two buildings draw off the same well?
Yes,
Yes. And,
yes.
okay. And so,
And I think that I think that the well on the town common, I'm not positive about this. If I don't know if that is the well that serves the church or not, but I think that well is also meant to be serving the old town hall.
okay, okay. So we could figure that out. And, but that, you know, I'm not gonna be making this plan before this year's town meeting.
Right.
This is gonna be a plan for another time. And, you know, because I'm sort of thinking about something else right now. And,
Yeah, I wonder why.
yes, and, you know, and I want to sort of finish one step before I start planning the
Sure.
next step and see, you know, but I do think that no matter what, that building will be used for some town purpose. And,
Certainly. Yeah.
and so there may be town employees that are using it who have a federal right to be able to wash their hands with actual water.
Yeah.
So,
Mhm.
it's good to, you know, we can think about that. And that's something, it's not going to be such an expense that it can't be, you know, we could do it at a special town meeting in the fall or something. So,
Right.
okay, good. Okay.
Okay, is there anything that you need us to do?
I don't think so. I don't think so.
Okay.
If, you know, if anybody asks if I talk to the Board of Health, I can just say yes. And, you know, and, yes, so, okay, good. All right. All right. Thank you.
Okay, thanks for
Thank
coming in.
you.
Thank you for all you do.
All right, bye.
All right. So we've got disposal works construction permits, 3. And I think they are all repairs, because these are all old addresses, and there's nothing interesting about them. They've paid the fees. Charlie recommends that we approve them. I don't have any specific details in front of me. No. All I need is for you to agree that I should issue them.
Move to approve.
Second.
All in favor?
Yes.
Okay.
Yes, from me.
All right. Okay, will do. There seems to be a lot going on. There's a few new houses being built in town. That hasn't
really?
happened much.
No, it
Yeah.
hasn't.
Yeah, one of them is, I guess it's at the corner of West Pelham and Baker Road, Elaine Weaver's house, and that's been split off. The house has been split off from a bigger lot, like several acres, and somebody's building there.
Mhm.
And there's a place over, I think it's on Leonard Road, where somebody took out various permits but didn't build and ended up selling to somebody else who's going to build and who got a new disposal works construction permit from us.
Mhm.
So yeah, that hasn't happened much at all recently. There may be another one that I can't think of. So today I went to a meeting of the district, and the topic of the meeting was trying to work it out so that Claudia can have proper benefits as an employee of the district and therefore of towns, because she's been paying her own health insurance, and she hasn't been getting any kind of retirement insurance. And so what is going to happen is we're going to try, I think Irving is willing to sort of take her on as an employee, and we'll have to have some kind of memorandum of agreement among the 3 towns of the district that would set up a revolving fund, so that the money, so that our share of that money would go to that town to pay into those funds for Claudia. It wouldn't really change anything as far as our assessment, although it may have to at some point be more, or anything else really. So it's just kind of a formality so that we can get some benefits for Claudia. So there's nothing that we need to do about that. What do you guys have to tell us? Anything?
I have only one thing, and it may pertain to you, Arlene. Apparently, Phoebe has gotten together a meeting of all the public health nurses. Apparently, there's some new public health nurses that have been hired by the towns to meet and talk about how they can provide coverage to one another should one of the contact tracers want to go on vacation. So I had asked for that kind of conversation and for a list of persons who are contact tracers in every town, so that everyone would be aware of who those persons are. Anyway, apparently the meeting took place and it was just among the public health nurses. So of course I had to get back to them and said, well, maybe it should take into account that not every town uses a public health nurse, that there are other iterations of how that takes place. So I'm hoping that that invitation to at least, was sort of a meet and greet meeting, and also with at least one of the intents to talk about is there a way that they could provide coverage for one another when someone goes on vacation. So we've got that in the hopper, talking about it, Arlene, but
yeah.
I
So
think
actually, I had known about that meeting, but number one, so I'm a nurse and I'm doing this contact tracing and case investigation work, but I don't have credentials as a public health nurse. And sometimes that is confusing to me about whether or not I am in the group that they're referring to. Do you know what I mean?
yeah,
anyway.
well, I didn't get that sense
Okay.
when I got the
That they're not
email,
doing
but
that.
if you're getting the notices, that's
Yeah,
good. I'm glad to
yeah.
hear that.
Yeah, and the other thing was that it was an in-person meeting, and I honestly did not, maybe I'm being overprotective of myself, but I'm just not feeling ready to go to an in-person meeting, especially, a few weeks before we're looking to travel and need to present all this negative test stuff in order to travel. So anyway, I can try to stay in touch with Phoebe about that covering for one another type of interaction. And if you hear more from her, please don't, even though I'm getting some of these notifications, I'm not sure I'm getting everything. Like I did not know that was part of the agenda.
Yeah, so I just
I
thought
did not
we
know.
should
So-
circle around to that. And I wasn't
Okay.
sure that I had told you that I had been talking about that at MAFCO and asking
Okay.
for that kind of,
Okay.
group to at least talk to one another. So, okay, well, that's updating both of us. That's great.
Okay.
Is there anything else that we should talk about tonight?
I'll just give an update, if that's okay.
Please do.
And I'll say that there have been no Maven reported cases in Shutesbury for quite a while. I think the last notification I got was on March 2nd or 3rd, but the person had waited quite a while after symptoms began before going and getting a test. So actually, there was only one more day left on their isolation. So anyway, nobody in isolation for quite a while in an officially reported fashion. I did hear from Katie Harrington, school nurse, today about a parent who self-disclosed to her that she tested positive on a home test last night. So that person is isolating, but it's not one that I have had any contact with. They've gotten the guidance from Katie. So that's the only case I know of in town. School began this week, their masks being optional. I think I got an email on, I think it was Wednesday, no, yesterday was Tuesday, that roughly 80% of the kids are still continuing to wear masks voluntarily. So it seems to be going well. That's all I have.
Okay, sounds good. Now, this infected parent, is that going to throw the school into a tizzy?
Well, unfortunately, the child is a preschooler, so is not vaccinated.
Mm-hmm.
And the child has some behavioral issues and is constantly taking a mask off. So they're home and quarantining right now, but there's going to be an ongoing exposure to the mom because the behavioral issues and the child's age also mean that they're not going to fully separate during mom's isolation. So teachers, I guess, are worried and concerned, about this child's return to school. So child's going to stay out a full 10 days, though, after their last day of exposure, because Katie and I discussed it today. If the child cannot mask when they return, then they really need to do the whole 10 days at home, 10 days after their final day of exposure. So that's going to allay the fears of people at school, I think.
Okay.
But it's a big hardship for the mom, who's a single mom, handling this.
Right.
Yeah.
Yikes.
Yeah. So anyway, the school's doing fine at this point.
Okay. Anything else that should be discussed tonight? I'm sorry, Arlene, remind me when you're going to be not here.
I depart 5 weeks from today, April 27th.
Okay.
And I return May 11th.
Okay, so you'll be here for the April meetings.
I'll be here for the April meetings. I'll be here for town meeting. Yeah.
Okay. Okay, so when the time comes, you'll remind us that next meeting you're not going to be here, because somehow I just can't keep track of it.
That's okay. Sure, I will do that.
Great. Okay, well, I suggest that we adjourn. Do I hear a motion to that effect?
You're here.
Second?
Second.
All right. All in favor?
Yes.
All right. Well done. Thank you, guys.
Yeah.
Thank you, Kat, and glad you
Yes.
had a wonderful